What is interpersonal psychotherapy, or IPT? IPT is a focused, evidence-based treatment approach with the main goal to treat depression. Depression is sometimes linked to distress in the quality of relationships and social functioning. Therefore, if this distress is reduced, it will help in depression recovery. IPT involves a detailed assessment which will allow development and an understanding of the interpersonal context of your depression. Then, usually one or two of the 4 focal areas is chosen by you and your therapist, which is linked to the depression. Firstly, the focal area of interpersonal deficits or difficulties in starting and/or keeping relationships going, such as social isolation or involvement with unfulfilling relationships. The grief and loss focal area aims to help individuals manage unresolved grief if the depression is linked to a death in their interpersonal relationships. IPT can help individuals deal with depression, which is often linked to transitions in life, such as retirement, divorce, or relocation. This focal area is also referred to as transitioning. Interpersonal disputes, which is the last focal area, helps in the treatment of a depression which occurs in those dealing with disputes, for example between partners, family members, close friends, and even within your workplace. Although IPT was originally developed to help those with depressive disorder, it is also shown to be effective in treating eating disorders, perinatal depression, drug or alcohol problems, and mood disorders, including bipolar disorder. A central idea in IPT is that psychological symptoms, such as depressed mood, can be understood as a response to current difficulties in relationships. It attends to difficulties arising every day in maintaining relationships and resolving difficulties, while suffering an episode of depression. The depressed mood can also affect the quality of our relationships. When a person can deal with the relationship problem more effectively, their psychological symptoms often improve. IPT treatment is structured and continuously monitored by your therapist. There may be tasks to practice in between therapy sessions aimed at making changes. These are always discussed within therapy. IPT is also based upon the concept that your social environment is a key factor in the onset of depression. Therefore, IPT targets these areas in order to alleviate these issues. This in turn will have a positive impact on alleviating depressive symptoms. And that is interpersonal psychotherapy, or IPT.